Hello everyone, these are the faces of the persons that the doctor said them that you got HPV, and these are the questions that come to their mind. How did I get HPV? How did it happen? Who did I get HPV from? How did I suddenly get HPV?
It's not true, but it is true.
HPV, the virus that infects only human with double-strand DNA and has 200 types. So, disease transmission, it can spread through close personal contact like anal or vaginal intercourse.
Common virus spread through skin-to-skin contact. Most people who are sexually active will get HPV at some point in their life.
In their life, I completed. So, keeping in mind that condoms do not completely prevent transmission of HPV. So, HPV virus can cause variety of disease like cancer, cervical cancer, vulvar cancer, and vaginal cancer. The other cancer like anus cancer or pharyngeal and penile cancer. So it usually takes 15 to 20 years for cervical cancer to develop after HPV infection. It means that you just had 15 to 20 years to prevent cancer. HPV can cause genital or non-genital warts, and it's not good cosmetically. The other disease that it can cause is respiratory papillomatosis.
Oh my god.
And Bowen disease. So what should we do? The WHO has a program that its name is 90-70-90, that based on it 90% of girls are fully vaccinated with the HPV vaccine by the age of 15. 70% of women are screened at age 35 and 45, and 90% of individuals diagnosed with cervical precancerous or cancers receive treatment. So what should we do before getting HPV is vaccination and living without HPV. So the next step, how many doses of Gardasil are needed? For males and females age 9 to 14, a 2-dose schedule can be adopted, and for all indicated individuals, a 3-dose schedule in a 6-month period is recommended. As you see, and keeping in your mind that you should complete within 1 year. But keep it in your mind that if you got vaccinated, you will be safe only against some subtypes of HPV, not all of them. So specifically, and the women should follow the screen program. So what is the screening program of cervical cancer? Someone who are actually the women who are 21 to 29 years old, they should do a pap smear every 3 years, or someone who are between 30 and 65 years, they should do pap smear without HPV every 3 years, or pap smear with HPV co-testing every 5 years. And someone who are older than 65 years, no pap smear required if previous pap smear was adequate and negative. So as an advice, get vaccinated, be sensitive, and be obsessive about your close personal contact. So good job and be careful. Let your friends actually be aware about this kind of dangerous virus by sharing this video. Good luck.